Good morning, everyone. Our topic for today's EL is Right to Health and Public Health Policies. This is Dhriti, and our teammates are Neelambika and Shashank. So let's begin. So coming to the introduction, the right to health ensures all the individuals can receive necessary medical services without discrimination or financial hardship. It covers aspects like preventive care, medical treatment, and emergency response to overall well-being. Governments shape health policies, allocate resources, and regulate healthcare standards to uphold this right. Coming to the legal and ethical basis of right to health is international frameworks. The WHO Constitution 1946 recognizes health as a basic fundamental right for all the people. Universal Declaration of Human Rights asserts that everyone deserves medical care and well-being. International Covenant on Economic, Social and Cultural Rights calls for disease prevention and universal medical treatment. National approaches such as UK NHS, a publicly funded system, offers free healthcare. US Medicare and Medalloyd government-run insurance for elderly and low-income individuals. India has Ayushman Bharat, provides free medical insurance for underprivileged groups. The ethical aspects include equal access. Healthcare must be fair and available to all without any discrimination. Patient rights. People should receive respected, informed, quality medical care. State responsibility. Governments must ensure healthcare systems are effective and well managed. Coming to key components of right to health, the right to health includes several key elements that determine how effective and fair a healthcare system is. First would be sufficient availability, which includes healthcare facilities, trained professionals, and essential medicines must be adequate to meet the population needs. Another aspect would be easy accessibility. Services must be within geographical, financial, and social reach for everyone. The cultural and ethical acceptability treatment must be respectful of social, religious, and ethical values, and also policy should promote informed consent, privacy, and dignity in medical services. High quality services, healthcare must be scientifically valid, medically effective, and continuously improved. Facilities should be well maintained, and doctors should have proper training and resources. The following slides will be covered by my teammate.
Thank you, Dhriti. Now coming into the role of government in public health policies. The main content of role of government in public health is governments play a central role in ensuring, regulating, and funding healthcare through policies and programs. One is policy making and regulations. This is to formulating laws to govern govern hospitals, pharmaceuticals, and medical standards, and ensuring ethical practices in clinical trials, drug approvals, and medical procedures. Second one is healthcare infrastructure and development. This is to constructing and maintaining hospitals, health centers, and emergency care units, and investing in research, advanced medical equipment, and digital healthcare. Third one is public health initiatives. Uh, it is to implementing vaccination drives, disease control measures, and nutrition programs. And also it is to running awareness campaigns on hygiene, maternal health, and mental well-being. And last one is health financing and insurance. It is to providing universal health insurance and a financial aid for medical care, subsidizing medicines and treatments for vulnerable groups. And next, coming into the types of public health. First one is preventive policies. Here, governments implement vaccination programs to control outbreaks. For example, polio, COVID-19, and surveillance system monitor epidemics and health risks to take early actions. Second one is curative policies. These policies guide disasters preparedness and hospital readiness and crisis management. For example, special units for pandemics, natural disasters, and bioterrorism. And last one is regulatory policies. Here, governments create educational campaigns about nutrition, exercise, and disease prevention, and laws regulate to tobacco use, junk food, advertising, and workplace safety, and also air pollution control policies to prevent respiratory diseases. And now coming into the challenges in implementing right to health. Here, first one is economic constraints. Here, funding constraints lead to shortages in medical stock, medicines, and hospital facilities, and high healthcare costs prevent affordable treatment for low-income population. And second one is infrastructure and workforce shortages. Here, shortage of doctors, nurses, and specialists in rural and remote areas, and it limited to awareness leads to low participation in health programs. And last one is political and bureaucratic barriers. Here, slow decision making delays critical policy changes. Corruption and inefficiency weaken health program effectiveness. Next, coming into the next slide, will explain by Shashank.
Hello. So next up, we'll be going through case studies of effective public health policies. That is, we'll be looking into what global success stories in health public. So examples of successful healthcare models worldwide are like universal healthcare in Scandinavia. So in Sweden, Norway, and Denmark, they offer like a free and low-cost medical care funded taxation. So India's polio education drive. So most vaccination and public awareness eliminated polio, showcasing effective disease control. So next example, like Japan's preventive healthcare model. So and then one more example was like Japan's preventive healthcare model. So next on we'll be moving into future of public health policies and right to health. So here we'll be going into like future healthcare strategies. So for example, digital health innovations. So telemedicine, AI-driven diagnosis, and wearable health monitors will expand accessibility and strengthening global health partnerships. So cross-border collaborations will help in combating global health crisis and integrated mental health programs. So mental health well-being will be integrated into primary healthcare systems. And last point to be noted, sustainable and climate healthcare. So here hospitals will adopt eco-friendly practices and health policies will be adapted for the climate risk. So concluding this complete presentation. So, a robust public health system is essential for societal well-being. Governments must ensure universal healthcare access, prevention strategies, and crisis readiness. While challenges like economic constraints and infrastructure gaps exist, successful global models prove that effective health policies can lead to improved expectancy, disease control, and better living standards. So, advancing technology, innovations, and international cooperation and inclusive healthcare policies will shape the future of public health. So that was the conclusion of the complete summary. And then, yeah, thank you.